Hello and welcome. Today, we're going to explore a rare and intriguing neurological disorder known as Landau-Kleffner syndrome, or LKS. This condition primarily affects children, impacting their language abilities and often leading to seizures. Join us as we delve into the causes, symptoms, and potential treatments for this challenging syndrome. The precise cause of Landau-Kleffner syndrome remains largely unknown. While genetic factors are suspected, no specific gene has been definitively linked to the disorder. Researchers believe that a combination of genetic predisposition and environmental factors may play a role in its development. Some theories suggest that LKS could be related to inflammatory or autoimmune processes affecting the brain, but more research is needed to confirm these hypotheses. At its core, LKS is characterized by abnormal electrical activity in the brain, specifically in the temporal lobes, which are crucial for language processing and auditory comprehension. This abnormal activity disrupts the normal functioning of these brain regions, leading to the characteristic language difficulties and potential seizures. The exact mechanism by which this electrical dysfunction occurs is still under investigation, but it's thought to interfere with the brain's ability to effectively process and transmit linguistic information. Landau-Kleffner syndrome is considered a very rare condition. Estimates vary, but it's believed to affect approximately 1 in a million children. It typically manifests between the ages of 3 and 7, although cases have been reported outside of this age range. LKS affects both boys and girls, with some studies suggesting a slightly higher prevalence in boys. The hallmark symptom of LKS is acquired aphasia, meaning a previously healthy child begins to lose their ability to understand and use language. This can manifest in various ways, including difficulty comprehending spoken words, reduced vocabulary, and trouble forming sentences. Seizures are also a common feature, occurring in about 70–80% of cases. These seizures can vary in type, including generalized tonic-clonic seizures, absence seizures, or focal seizures. Other possible symptoms include behavioral changes such as hyperactivity, attention deficits, and social difficulty. Diagnosing Landau-Kleffner syndrome can be challenging, as its symptoms can overlap with other neurological disorders. The diagnostic process typically involves a thorough neurological examination, including an assessment of language abilities. An electroencephalogram, or EEG, is crucial for detecting the characteristic abnormal electrical activity in the brain during sleep, often referred to as epileptiform discharges. Magnetic resonance imaging, or MRI, may be performed to rule out other structural abnormalities in the brain. A diagnosis of LKS is usually made based on the combination of clinical symptoms, EEG findings, and exclusion of other possible causes. While LKS itself doesn't have distinct subtypes, it's important to consider the variability in symptom presentation. Some children may experience more severe language impairment, while others have more frequent seizures. The specific type of seizures and the degree of behavioral changes can also vary from child to child. Understanding this individual variability is crucial for tailoring treatment approaches. The primary goals of treatment for Landau-Kleffner syndrome are to control seizures and improve language abilities. Anti-epileptic medications are often prescribed to manage seizures. Speech and language therapy is a critical component of treatment, helping children to relearn language skills and develop alternative communication strategies. In some cases, corticosteroids or other immunomodulatory therapies may be used to reduce brain inflammation and improve neurological function. Surgery, such as multiple subfield transection, may be considered in severe cases where other treatments have been unsuccessful. Currently, there is no known way to prevent Landau-Kleffner syndrome. Given the unknown etiology and suspected genetic component, preventative measures are not yet possible. Early diagnosis and intervention are crucial for maximizing a child's potential for language recovery and minimizing the long-term impact of the syndrome. The prognosis for children with Landau-Kleffner syndrome is variable. While some children experience significant language recovery with treatment, others may have persistent language difficulties. The severity of language impairment at diagnosis, the effectiveness of treatment, and the presence of other neurological issues can all influence the long-term outcome. Recent research is focusing on identifying biomarkers that can predict treatment response and developing more targeted therapies to address the underlying mechanisms of the syndrome. Studies are also exploring the potential of newer anti-epileptic drugs and advanced neurorehabilitation techniques to improve outcomes for children with LKS.